Dear friends and colleagues from member states, UN agencies, NCD Alliance, the NGO community, women's health advocates, and friends from Arogya world. I would have very much liked to be with you in New York to bear witness to a very important survey that projects loud and clear the anguished voices of 10,000 women in the developing world on how NCDs are impacting their lives. This survey is so important as it lifts the lid on 5 powerful words: impact of NCDs on women in the developing world, and delineates them on many levels. The survey deciphers and translates every single letter into the real daily struggles of a real human being, on what it is like to be in the developing world and deal with the devastating impact of diseases that are chronic, super expensive, and hard to treat. The survey then takes the analysis deeper and sheds light on the extra burden on women for being simply women, who are the caretakers of their families, and how their lives are made so much harder and even impossible as they face NCDs. The survey also digs deeper and shows us the devastating impact of what it is like to be poor and having the super extra heavy burden to face an NCD. The results of this survey are all too familiar for me. I know all this from 2 perspectives. As a head of a cancer foundation, the King Hussein Cancer Foundation, in a developing world context, and as a mother of a cancer survivor. I can tell you that I was of the lucky few who had the chance to access the best of cancer care and have the means to pay for it and take care of my whole family, and on top of that have the total support, both financial and psychological, of my extended family. Yet, despite all of that, the fight against my son's cancer that took us on a hard, tortuous journey of 4 years of treatment that included a bone marrow transplant was really, really hard on all of us. So I cannot dare to imagine, not even for a second, what it is really like to combine the struggle of dealing with an NCD such as cancer with poverty. To me, cancer diagnosis alone equals a disaster. But cancer plus poverty equals catastrophe. Every day at the King Hussein Cancer Center, we are bombarded by women who are desperate for help. We hear way too many tragic stories about women and mothers who are in a state of panic and desperation because they do not have the financial means to treat themselves or their children or their family. Women who resort to using definitely more than 25% of their family's income to pay for illnesses. Women who have to borrow money in order to pay for a hospital bill or a doctor's fee. Women who completely avoid seeing a doctor altogether because they lack the financial means to do so. Even when we are able to cover their treatment expenses, these women do not even have enough money for transportation to our medical center. If it weren't for the several programs that our foundation initiates to offer financial support, many people would simply die. These same women are juggling so many things in their lives and are constantly overburdened by responsibilities, caregiving, and taking care of others. And so it is not surprising that they do not find enough time to take care of their own health, as they struggle to find precious time and financial resources to eat healthily, cook nutritious meals for their families, and let alone have the time and energy or money to take life-saving measures such as early screenings and regular medical checkups. Furthermore, to be a woman and be poor and be faced with an NCD means that they are totally excluded from the very measures that are supposed to protect them against NCDs. Lack of time, money, and knowledge mean that they are the very segment of society who are the primary consumers of risk factors of NCDs and are the easy targets for deadly tobacco companies and cheap and unhealthy food. And so the question we should all be asking ourselves today is, how can we be the voice of all the millions of people and women who will lose their lives to NCDs if left unresolved? I call on all leaders in the room today and on leaders everywhere to listen to what these women are telling us and make these 10,000 voices count for something. We must implement gender-specific NCD guidelines that actually fit the real lives of women and families and strengthen existing healthcare systems and services. Most importantly, we must help women cope with the cost of NCDs. I pray that universal health coverage will indeed become a reality in my lifetime. I wish you all and Arogya world the very best to make that happen. And I will lend my support in any way I can, because when women are empowered, the whole world can prosper. Good luck at the meeting today, and thank you very much from all of us here at the King Hussein Cancer Foundation, Jordan.